Then we will call the meeting to order and welcome everybody. I'll remind everybody to please disclose of any pecuniary interest at the appropriate time. And is Dr. Renaday here? Hi, how are you, Dr. Renaday? I'm going to ask you to turn your volume up a bit. We can't hear you.
Okay, I'm at max now. Does that work?
Okay, that's better.
Okay.
Thank you. I'm going to turn the meeting over to you.
Great. Okay, thank you, Councillor. So I have a few little things to talk about, and then I'd like to share a very quick presentation with you about just sort of changing our mindset with regards to COVID. So while we make sure that I'm able to share my screen, I will just give you an update on numbers. So I would characterize the outbreak right now, there's no scientific term here, but just grumbling along. Right, so we've gotten little blips and we've been able to identify those folks and manage their contacts and isolate around them. And so far, most of the ones, in fact, almost all of them that we're getting are coming from either known sources or close contacts, household exposures of known cases. So that brings us to about 336 cases to date. And our number of recoveries are 299, which brings me to a couple of questions that were asked for this meeting. And so the first was, what's the percentage of COVID cases that we're seeing from community transmission? So there's really no good definition for community transmission, but I think if the question is getting at what are the ones that are coming from unknown sources or places that we can't trace back, in the latest grouping of cases, that's very low. I think it's one, maybe two cases that were uncertain of their exposure. The rest are from either known household contacts or exposure through close contact settings like a workplace or a community meeting, things like that. So, and that's consistent with what our earlier data showed, that about 75 to 80% of the contacts or cases that we identify are either close contacts or in the context of a known outbreak in which you would expect there to be some transmission. The other question is, what progression are we seeing in the severity of cases? Because we seem to have cases, but they don't seem to be hospitalized or dying. And so there are two answers to that question. One is fairly certain, and the other one is uncertain and requires more investigation. One of the answers that requires more investigation is that there's an idea floating around that there are multiple strains of this virus, which is true, but that the strain that's dominant right now is one that's milder, less aggressive, and maybe easier to transmit because it is less aggressive and milder. In order to establish whether or not that's true, you require genetic testing to be done on the samples that are identified as positive. And so tomorrow, when I have a provincial call and the public health labs are represented, I'll ask that question as to whether or not that kind of strain typing is being done to identify if there are different strains that are dominating in their circulation. We know that there are many different strains. What's unclear about that is whether or not the fact that they're different makes them meaningfully different in terms of the symptoms that people display when they're infected with them. So to get a sense of whether or not there's a difference in strains that's dominant, we'll take that question back to the labs and see if there's any effort to undertake that research. The other piece to it, though, is that we know that in Canada and in Ontario, the larger portions of the incidents are being driven by younger populations, 20 to 49. And so this population itself is less likely to suffer severe consequences of disease, less likely to be hospitalized, and so forth. And so that's one thing we can say definitely accounts for some of it. As to whether or not there is this other strain or that there's a change or difference in dominant strain, that's an ongoing kind of question for research. So with your permission, I will share my screen with you. Hopefully you can see this. And I just have a very short presentation for you just to go through kind of where I think this is going or how we need to think about it. Can you just confirm, somebody, that you can actually see this screen?
Yes, we can.
Okay, great, thanks. So I'm calling this moving the goalpost because I think we need to be conscious about thinking about COVID differently, right? In the early days of this, February, March, April, right, it was like new, we're all kind of stunned by it. The goal is really to contain and protect it. So you saw, or protect against it. So you saw lots of closures of public spaces, prohibitions around social interactions, protection around long-term care homes and vulnerable groups, and a boosting of our collective testing capacity through multiple initiatives. And in the early days of this, right, it's about learning and understanding what we're dealing with. So we started to recognize an expanded set of vulnerabilities in individuals and in our structures. growing recognition of the disease transmission pathways. And so we're pretty sure that it's largely droplet, and where we once thought that surfaces might be a transmission driver, there's thinking, now that largely that's not the case. And then we also started to recognize some key transmission settings. So healthcare was a really key transmission setting, personal service, close contact settings where you're with someone for a while, either providing care to them or socializing with them. So if we think about longer range COVID goals, right, the idea is that COVID's around, it's here, it's with us until it's eradicated or until there's an effective vaccine. And so the goal really now is to balance protections with having an open society, or a relatively open society, which involves reviewing what worked and what didn't work in other places and why, and trying to have as much of our society function as normally and as safely as possible, which I will note is not a zero risk proposition, right? So the goal is not to have 0 cases, to stamp it down absolutely so there's nothing, but to keep the number of cases manageable and to ensure that enough things are working while balanced against the need to protect against disease. The other thing we're doing is applying our knowledge to these shifting goals, right? So we need to change our explicit goal from preventing all transmission all the time to keeping the transmission manageable while protecting vulnerable people and preventing severe outcomes. Remember, if you think about contacts and risk, the greatest risk is the closest contact for the longest duration. So a study of about 75,000 cases from China noted by the WHO showed that 78 to 85% of transmission in all of those cases was identified through the household, followed by close contact, which is the next level of risk. So sharing meals with people, attending faith community or other community groups, being in close contact in the workplace, which is a key driver of infection from our food processing sector, healthcare, and personal services. They drive much of the remainder of transmission, followed by the casual contacts, which are limited duration and variable proximity, which is generally thought to be the minority of transmission. So I think as we move forward, we need to think about a more comprehensive approach to COVID, which is to say that we should have interventions that apply to everyone: physical distancing, respiratory etiquette, hand hygiene, isolating yourself when you're sick, and wearing a mask when you can't keep your distance from people, along with some targeted interventions for high-risk people. We need to think through what that might look like, because of course you can't keep people isolated or alone forever, but certainly maybe when the prevalence of disease starts ramping up, maybe we approach something called shielding or cocooning, which was tried in the UK, whereby you take people who are at higher risk for severe outcomes and provide them with the social and clinical supports that they need to isolate successfully, along with supporting an ongoing case and contact identification and management. So we've done okay with that. We've met our milestones and our targets related to that. But again, the system itself is planning for what if there were to be a significant surge capacity on cases and managing all of the contacts as people start seeing more people. And we're seeing a bit of that through the province. Finally, just a few things to keep in mind. These are sort of the questions that are out there that we haven't really resolved yet, but of course the work continues, and as we find more information, we reevaluate. One, what's the true prevalence of asymptomatic infection? Currently thought to be fairly low, but again, more and more studies will evolve that over time. What is the idea that people might be reinfected with this, or what's their duration of immunity after they naturally fall ill with COVID? There is some emerging evidence that the duration of immunity is strong. Sorry, not the duration, but the natural immunity is strong after you get it, but the duration is unknown, right? We just don't have enough experience with this disease. The other emerging issue is, what are the transmission dynamics in children, especially those under 10? Lots of emerging evidence shows that there's this sort of inflection point at 10 years old, and people over 10 seem to transmit the virus more like adults do, and people under 10 seem to not do so. We don't know why that is, but certainly in all of the outbreaks that have happened in elementary schools, when they did transmission dynamics and contact identification, kids under 10 were much more likely to get the disease from their household contacts than they were to get it from other kids or from the school environment. And so we don't really know why that is, but we know that there's some evidence out there that it may be true. And so that kids under 10 may not be, while they are equally susceptible to getting illness, they may not be key transmission drivers of illness. And then, of course, there's lots of developments on the vaccine front that I think you're probably paying attention to. Testing developments, Public Health Agency of Canada has approved a number of new tests. However, none of them would be what I would characterize as game changers. So a game-changing test here for the purposes of screening or quick identification would be rapid, reliable, high volume, and it would not necessarily require the transportation of a sample to a lab in order to get the test. So you could do a very quick test, identify if someone has disease, or at least rule it out, that you could be very clear that a negative result was fairly accurate, and then push those tests into the system. So none of the tests that have been approved have been what I would call game changers in that way, but we are incrementally driving towards those kinds of game-changing tests, and I hope that we get them. Finally, the biggest priorities in terms of sector planning for the fall are, of course, the health system and the education system. So with respect to the health system, we have ongoing discussions with the Ontario Health teams about how to make the assessment centers sustainable in a time or a season where you would also expect coughs and colds and some flu symptoms to come in alongside COVID. And if the prevalence of disease is low in the community, most of the respiratory illness that you see will be coughs, colds, and flu. But in order for the health system to adequately treat them or assess them, they have to treat those things as if they're COVID first, rule out COVID, and then see the patient, right? So planning for sustainable assessment centers in the fall is one big piece. The second big piece is planning for the return of schools. And there are 10,000 students who are coming back to school in the fall. They're not all coming back to in-person classes, but that presents a significant challenge in terms of transmission dynamics and the potential for resurgence of disease. So public health is working with the schools to help them with infection prevention and control, to help them work through the guidance that they're receiving from the ministry on how to run the school and what things to engage in. And on the other side of it, we're going to be working to make sure that we can easily and quickly identify outbreaks or cases that might lead to outbreaks. So I think I will stop there. So I've stopped screen sharing, so you should be able to see me now.
Yes.
Okay.
Thank you for that presentation, Dr. Renaudet. Does anybody have any questions for the doctor? Councillor Stark, please.
Yes, Doctor. With respect to your comments regarding transmission of children 10 and under or 10 and over, whatever the case may be, you referenced studies that have been done, but how could studies have been done when the children have not been in school since March? So how do we know what the transmission between students is when they haven't been in the environment that you're referring to?
Good question, Councillor. So it's not studies that have been done in this jurisdiction, because we, of course, did not have our schools open. They are international studies that were done in places that did reopen their schools. So in some other countries, schools have been open in May, June, April, even in some cases. And so it's learning from the experience of those places, those other countries.
However, as a follow-up, if that's the case, and I accept your answer, if the positivity rates are different in those areas, how is it fair to draw an analogy between them and what is clearly a low positivity rate that we are experiencing in Lambton County?
Yeah, so the analogy is not directly with respect to the likelihood of outbreaks in schools. The analogy is with respect to how COVID-19 transmits in schools once it's there. So I agree with you. The WHO has also said the safest way to open schools is in the context of low community transmission. That is the number one thing that you can do to ensure that schools open safely, which means that keeping an eye on transmission in the community is key to preventing outbreaks in schools, right? You can do only so much in schools, but the highest driver of prevention comes actually outside of the school to say, what is the prevalence of disease in the local community? And so yes, some of the studies come from places that had opened schools when they also had high community prevalence, but what you learn from it is how COVID spreads in the school, which is independent of whether or not the community prevalence is high or low once it's in there.
Thank you.
Councillor Arnold, you had a question?
Yeah, I had actually three, Madam Chair, but I'll start with the first one. And I wanted to ask Dr. Renaudet, I listened to way too much stuff in regards to COVID and everything else, of course, but they talk about the vaccine effectiveness. And normally influenza, they aim for around 40%. And is the COVID vaccine, from, in your professional opinion, do you think it's going to be any better than 40 to 50% effectiveness in the community? And then what happens at that point if it's not? We're no different than what we are currently, I guess. It's the fear that I've been given. Like, we're being driven by fear by so many people right now. And so you get all these fearful questions, and that's a major concern for folks.
Yeah. So there's a lot of fear, and the fear is pushing the drive for certainty on things about which we don't have certainty, right? So let me talk about the issue of the vaccine. So one, it's important to remember that a vaccine for a coronavirus has never been developed. Okay, so we had SARS, we had MERS, we had all these things. Work progressed to try to find a vaccine, but in fact, when these things sort of fizzled out, there wasn't enough of a market force to push the development of that vaccine forward. Now there is, certainly, and so you're seeing lots of efforts to develop a vaccine. The difference between what I understand the vaccine approach to coronavirus is compared to the flu virus, okay, is that the flu virus, because there's so many circulating flu viruses, what is done to decide on a flu virus is you basically look at emerging viruses, look at the circulating strains, decide which are dominant, and decide which to put into your vaccine. And then if the circulating strains in your season match the circulating strains that you've put in the vaccine, you get a good match and good effectiveness that year. Sometimes you don't. The coronavirus vaccine is intended to be different, right? Because it is focused on this one coronavirus, the SARS-CoV-2 coronavirus. It is not thought to be strain dependent. And so the pieces that they're focusing on immunizing the body against are parts of the vaccine that do not change very much. And so if the vaccine were to come out, I would expect that its effectiveness would be larger than 40%, okay? Having said that, even a vaccine that's 40% effective can be dramatically effective at stopping outbreaks if you immunize the right people. And so there is some interesting suggestion out there that the target population for vaccination should change depending on the effectiveness of the vaccine. And if the vaccine is thought to be of low to moderate effectiveness, then we should be targeting people who are at high risk of severe outcomes to basically just immunize them and give them additional protection. If the vaccine is thought to be highly, highly effective, then in fact, you should target the people who are responsible for potentially spreading the virus in the community, which actually targets a younger age group, if it's thought to be highly effective, to actually provide a barrier to anyone that they might come into contact with. So all these discussions are ongoing. They would depend on what the vaccine effectiveness ultimately is, but I would expect that it would be more likely to be effective than what we see for flu vaccines because of the way that the vaccine is being generated. It's not sort of strain dependent or targeted to these different things that change. Sorry, that was the long answer. But.
No, just to follow up, I think that was a great explanation. So in my simple mind, it'd be more like a polio vaccine or something for measles, mumps, and rubella. That'd be the type of targeting that it would be, instead of just a regular influenza that we don't really know what's going to happen.
Correct. That's
okay.
Yeah.
And the other question I had, Madam Chair, actually two of them are kind of interrelated. I just would like to get Dr. Renaday to reassure me that his masking recommendations haven't changed. And also I'm getting a lot of people, or not a lot, a number of people have talked to me about if we were to put in a bylaw in regards to masking, they'd like to see it in permanently, because they feel that it would stop the spread of influenza. And I'm just wondering if Dr. Renaday could comment on that.
Okay. Maybe I'll take
I don't want to put you on a spot, but...
No, it's fine. maybe I'll take the second one first and then go back to the first one, okay? Because the answer to the second one is really, why haven't we had masking bylaws to prevent against influenza? And I think the answer to that is because in an average influenza season, the population level mortality and morbidity is low. And so, and partly because we've mentally integrated influenza into our lives. It's around, it's here, it's seasonal. And because of the seasonality to it, you might also not really need to do those interventions in the summer when they might be more helpful in the fall or the winter, right? And so I think that's probably why you wouldn't have seen those things earlier for things like influenza. Having said that, there's lots of historical analysis on the influenza pandemic of 1918 when there was widespread masking, and also, in fact, the same discussions that are playing out now played out 100 years ago around that pandemic, right? About should you or shouldn't you? Is it useful? Isn't it? When should you? When shouldn't you? What about the fear? What about making people feel safe? It's literally exactly the same thing from 100 years ago from everything that I've been reading. And so that's why you haven't seen it and why you're seeing it now in response to this as opposed to influenza. But all of the things that protect you from COVID protect you from influenza, with the exception that we have a flu shot for influenza that we don't have for COVID yet. Mm-hmm. When you go back to the conversation around the mask bylaw, the evidence really has not changed that much. My recommendation has not changed that much. And I give you a few pieces of evidence that support what I have been saying about where the disease is transmitted, okay? So places that have had mandatory masking bylaws in indoor, retail, or commercial settings are now exploring the possibility of having outdoor masking bylaws. They're now exploring the possibility of having expanded bylaws to workplaces where if they weren't publicly accessible, now they have to go there. I'm talking about places like France, places, right? And I guess the question that you have to ask yourself then is, does that mean that the masks don't work? Or are they not being used in the right way? And I argue it's the second one, right? So all of the evidence around masking really comes from highly clinical settings where you are delivering care to a person. You are right up in their face for a really good long period of time, and you're doing something with close contact. What has happened with the mask bylaws is that they have been extrapolated to settings that may not be so applicable to where the evidence was generated. But where the evidence was generated in a close contact setting, masks can provide a good barrier to transmit into infection prevention when you're in that setting. So what are other kinds of settings that look a little bit like the health care setting where we have the evidence from? Well, personal service settings might look a little bit like that. I had it in my, bars might look a little bit like that because you're really close up to people and there's lots of shouting and yelling and you're right. And finally, gatherings, places where you're actually close to people, where you like people, where you're not on guard with them and where you're not having physical distance because they're your friends and family. Those are the places where we see lots of transmission happening. And so as we move into the fall, I think those are the places where we're going to be increasingly recommending mask use to protect vulnerable people in gatherings that used to be able to happen outside that are now moving inside. It's those close contact settings. So not to say that it shouldn't be done or that it might not give you the feeling in the community that people are protecting each other or that it might not drive a desirable behavior change, but certainly the evidence is as I have just described to you. So that hasn't really changed that much. And it's just interesting to note how similar this is to 100 years ago.
Mm-hmm. Thank you very much. Thank you, Jackie.
Thank you. So based on your presentation, it almost makes more sense for me to put masks on my kids when we go to see my parents because they're in a closer setting than even going to the grocery store or running into the hardware store.
That would be the most consistent with the evidence that we have. And in fact, when we move into the fall, as people start to move indoors, I'm going to be actively considering making recommendations around the specific use of masks for those kinds of gatherings.
Okay, thank you. Yeah, I think the information getting out, the actual factual information getting out to the public is really super important. So thank you for your time. Does anybody else have any questions for Dr. Renaday? Being none, I'll let you go. Oh, sorry. Councillor Boucher, did you have a question?
I have a question, a statement really. I'm getting a lot of people saying whether they should wear the face mask or not. And then they end up saying, well, you know what, the doctor, our our medical officer of health does not recommend it. And that's kind of confusing to the public in Sarnia. I'm not critical of your opinion, but if I was in your place, I would say I would recommend it. I would recommend you wear it and move on. It
I
seems
believe
like
that's what Dr. Renade has said from the start, is that in close proximity to people, when you're in that close proximity and you can't social distance, that's when you should be wearing it. I think he's been very clear on that, as well as the rest of the medical health officers.
Absolutely.
So it's one of those things. We can't mandate that when you go and visit your mother that you have to wear a mask, but he can recommend that. We can't mandate that. That would be impossible. Anyway, this discussion can go on for a long, long time, but I think we're going to wrap it up for today as far as masking is concerned. And thank you very much, Dr. Renade, for your input today. It was very helpful.
Thank you.
And we're going to move on to the long-term care division. We have 2 information reports from that division. So I do need a mover and a seconder to have those reports put on the floor. Councillor Broad and Councillor Hand, are you both comfortable with this motion being for both those reports, and we can discuss them both together? Yes, okay.
I am.
That's great. So do we have any questions for Ms. Joris on these reports? Or Jane, did you want to go over highlight anything on them for us?
No, unless someone has some questions, I think they're fairly straightforward.
Yep. Councillor Hand.
Sorry, I had 2 questions. One was around the phrase licensed bed. I wasn't sure what that was meaning. And just the other question was more, if I could get a comment, like the adult day program is closed. Do we have any expectation of being able to reopen in some fashion, or will it just continue to stay closed?
So the first question is that all long-term care beds in Ontario are licensed by the ministry.
Okay.
And so people, organizations or municipalities receive approval for licensing for a bed. So the beds are dependent in your area on the number of licensed beds.
Thank you.
We did receive an extra bed for Marshall Golden Manor for a year, a temporary license for an extra bed for a year at the beginning of COVID. So,
I think that's the one I was referencing. I didn't understand what that was about. Thank you.
and we are working on a plan to reopen the day program safely. The regional group of adult day program operators has been meeting, looking at how we could open safely. It will probably be with, 1 or 2 people originally. And we're looking at, or in the beginning, we're looking at expanding the virtual day program so that some people would be virtual and some people would be on site. So the plans are in the works for that, and we're also gathering up some PPE, so we have enough PPE to offer those services.
Thank you. Appreciate it.
Thank you for that question. I had the same one, Councillor Hand. So any other questions for Jane today? Seeing none, we'll approve the receiving and filing of those reports. All in favor? That's carried. And we'll go to B, which is a report requiring a motion. Do we have a mover and a seconder for that to have it on the floor? Councillor Arnold and Councillor Cook. And any questions on that recommendation or on the report itself? You're doing really good today, Jane. All in favor of that? That is carried. And I don't think there's any other business, so we'll move on to Corporate Services Division. And there is a correspondence here report to be received and filed. So I don't know if anyone wanted to support that or how council wanted to deal with that. Councillor Arnold, are you moving to receive and file that? Okay, and we need a seconder for that. Councillor Stark, thank you. All in favor? That is carried, thank you. And there's 2 reports requiring a motion. I'm going to cover those separately since they do require a motion. We need a mover and a seconder to have those put on the floor. Moved by Councillor Loosely, seconded by Warden Weber. Any questions or comments about that?
Just so I'm sure where we're at, are we on the corporate service division dealing with the proxy voting?
The amendment to procedural bylaw number 33 of 2014 electronic meetings report.
Yeah, that involves proxy voting, I believe.
That's the next one.
That's the second part.
That's the second one.
I'll wait to reserve comment there.
Okay. Any questions or comments on this one? Seeing none, I guess we'll, Warden Weber.
Just to clarify, I believe the AM committee dealt with this, if this is the same report, and Stefan explained that it was, it's either you can have an electronic meeting or you can have a meeting in person. You can't have an in-person meeting with a couple individuals not coming in person and being part of the electronic. So it's one or the other.
Okay.
And that, just so that everybody's clear with that.
And this could be used in case of a snowstorm where we had a meeting set up, we can still gather together, which is, I think, very appropriate. It's a good way of dealing with it. Councillor Hand.
Sorry, this, what Warden Weber's saying goes back to our earlier vote some time ago where we said you're in person, you can't like phone in or sign in from off-site. So that still stays in place.
Yes.
And then we also have the option of having appointed a delegate, which
Exactly.
most of us have done that, I think.
Yes.
Okay, thank you.
Yeah. All right. All in favor of that? That is carried. Thank you. And we'll move on to B, which is the report dated August 19th, 2020 regarding amendments to procedural bylaw 33 of 2014, which is the proxy vote. We do need a motion to have this put on the floor, moved by Councillor Broad, seconded by Councillor Cook. And does anyone want to, Councillor Stark, do you have a question?
Yes, based upon what I read in the report, I will vote against proxy voting. And quite frankly, if you look at this from an outside perspective, this really favors larger municipalities who have weighted voting. In theory, I could give a proxy vote to a member of another delegation, whether it be petroleum, it doesn't matter. The point is that you can have stacked voting, which I think goes against the philosophy of the Federation and getting representation of votes that reflect the best interests of the Federation as opposed to the dominant municipalities. So I will vote against the proxy voting.
Mr. Tifo, would you like to clarify on that matter?
Yeah, and I just want to explain sort of what the proxy rules are now and what its impact is on Lambton County Council. And of course, its impact on Lambton County Council is quite different than the availability of the proxy nomination process at the local level. In terms of the proxy rules, in short, any member of a local tier that sits at the county council level who also has a local tier member sitting here, so multiple members from one local tier, any one of those members can nominate somebody else within their own municipality who also sits here as their proxy, on an issue or for a meeting. And so therefore, in practical reality for Lambton County Council, only 3 municipalities would benefit from proxy voting, potentially. Sarnia, multiple members, Lambton Shores, 2 members, and of course, St. Clair, 2 members. All other local tiers at Lambton County Council will not benefit from proxy voting because you can only appoint a proxy that comes from your own municipality here at the county. At the local tier, you can appoint your own members as is. As Councillor Stark noted, and I believe Councillor Hand as well earlier in the earlier discussion, there's alternate means of participating here at County Council as well. Alternate members are being appointed. We have 9 of our 11 municipalities who have appointed alternate members for those of you who've appointed one when you're absent or required to be absent from a meeting. Those alternate members are nominated by your local council. So for instance, if Sarnia nominated an alternate member, it would have been nominated by local council. Note that the proxy rules are different. The proxy rules where you're eligible to nominate a proxy is done by the individual member. So it would be like Bob telling John to go and vote at a meeting for him without necessarily involving local council in that decision, unlike the alternate members. So those are practical realities that council needs to be aware of. There are other, let's call it behind the scenes, potentially political issues that we don't get involved with when it comes to practical processes and the consequences of proxy voting. But for us, the only intent in writing the report was to let you know that the option is available. We do not make a recommendation either way. This is squarely your own rules, your own processes. And so we're fairly neutral. But that being said, again, the practical realities, as I've noted, are as follows. Only 3 municipalities would benefit from potential proxy voting here at County Council, and 9 of the 11 municipalities have already appointed alternate members through their local councils as alternates for those of you who are required to be absent for any one meeting.
Councillor Stark.
So, Stefan, just so I'm clear, I was incorrect in my assumption that I can assign my vote outside of my municipality.
Insofar as your seat is concerned at Lambton County Council, correct. You could only appoint at Lambton County Council a proxy that comes from the city of Sarnia. So you have 4 other options. You could not, for instance, appoint somebody outside of your municipality. At the local level, of course, you can appoint any one of your members that sits on council.
Okay,
So essentially, he could assign Margaret Bird or Dave Bushy as his proxy, but nobody else. He couldn't pick somebody from his own council and just say, hey, go in my stead and vote for me. Or a staff member, or it would have to be somebody who is seated on county council.
That's correct. So in Sarnia's case, there's 4 potential options for your proxies. But again, Sarnia also has an alternate member, which the alternate member rules are different than the proxy rules, but Sarnia Council has nominated who that alternate member is. Again, it's a council decision when it comes to alternate members. It's an individual councilor's decision when it comes to proxy, provided that their scope of individuals that they can nominate as a proxy comes from their local municipality as well.
okay. So just to be clear, in effect, my analogy of vote stacking is irrelevant because it's within the same municipality.
It could be, but you're getting into other issues, which I think you're also touching, you're nibbling at the edges, which is division of loyalty, even amongst your own councilors, right?
Yeah.
And I say that because there's a practical reality, which is when you show up to a meeting, you show up to listen to debate. The proxy system, and again, I'm not taking a position either way, but the practical reality of proxy is, I don't care what the debate says, I've predetermined how my vote is going to be, and Bob's going to vote for me. Right, so you're nibbling at the edge. It's not completely irrelevant, but it does invoke those concepts, those issues.
Did this go to the AM committee as well?
Yes.
Correct.
Is
And the
it-
AM, correct. And the AM committee wanted nothing to do with it.
Okay. Councillor Broad.
Yeah, just I didn't realize Stefan was on the Zoom meeting. Back to the previous information that we had there on that motion. We had a situation there this year where at roll call, one of the Sarnia councillors had put their alternate member in, and roll call was Stefan did the roll call. The alternate member said present, and then all of a sudden, 15 or 20 minutes later, the alternate member was gone, and the regular member came back on. What's the deal on that, Stefan? Like, are they allowed to do that? And how many times during a meeting can we do that? Can we do it through the entire course of the meeting? So just like a little clarification on that, Stefan. Sorry, I didn't realize you were on the call there. Could you clarify that for me?
Yeah, no, that's a stacked question. It's not dealt with in black and white in the municipal legislation. If I was to say, is it possible, for instance, to have your alternate member be in there for the open session, because you can attend the open session, but you're there for a closed session or something to that nature? I don't see anything that prevents that. That being said, and it's still subject to interpretation, I would imagine and I would believe that the proper way of using alternates is for full meetings. So that, unfortunately, is sort of my knee-jerk reaction to that. It's, I believe, truly $1 million question. But aside from the legal aspect of things or the procedure aspect of things, ultimately, you also have council members who control processes as well in meetings. And those are issues that can be addressed if there's a true concern.
Thank you.
Councillor Cook.
Thank you.
Councillor Cook, do you have a question?
Yes, through you too, Stefan. So I guess in one case, you could actually use the alternate member to get around the conflict of interest rule. If you declare a conflict, don't go to the meeting and appoint somebody to go and vote in your place. You could, in essence, be making the vote different than if you had to be at the meeting and as attending by appointing your alternate to vote in your favor when you're not there.
Yeah, so that would be a concern, and again, a bit of a concern that's related to some of the issues that Councillor Stark was alluding to. But in terms of the black letter law, you cannot do indirectly, i.e. through a proxy, what you can't do directly. So if you were to nominate somebody as your proxy, but yet you had a conflict of interest as defined under the MCIA, the Municipal Conflict of Interest Act, you would trigger the same potential consequences and repercussions, because the proxy is meant to act as your alter ego, your agent. So anybody who thought they can game it, and it's based on facts, you only know what you know in terms of demonstrating a conflict. But if anybody thought that they can game it through a proxy, they would face the same consequences as if they were there in person.
Okay, Doug, or sorry, Councillor Cook.
So just to follow up, if it was the alternate member as opposed to a proxy, would the same rules would apply then?
No, that's a good clarification. The alternate member acts in his or her own capacity.
However, the person still should disclose the conflict of interest. The member should still disclose it at the next meeting when they show up.
That's correct. That's black letter law. So if you're a member of council, you weren't at a meeting, you still have an obligation, a positive obligation to disclose that conflict, assuming you didn't do so prior to.
Okay, so we will move on to the vote for this since it's on the floor. All in favor? All opposed? That is not carried. Thank you. We have no other business, so we will move on to finance and facilities and court services. We just have one information report there. We need a mover and a seconder to have it put on the floor to receive and file. That is moved by Councillor Stark, seconded by Councillor Arnold. Any questions about that report? Councillor Stark.
One question as it relates to, and I believe it's on page 38, section 2, it talks about group benefits and the fact that we've saved $100,000 because of layoffs and just reduced need for premium payments. My question is, why are we not putting the total value of the premium reduction into a reserve account that's directly related to the future use of those premium or requiring premium payments? I don't know who can answer that.
Mr.
Yeah,
Polacchio?
through the chair, I think basically the approach the county is taking is a balanced approach in that there are always ups and downs when it comes to benefit usage, and taking a portion of our savings and putting into reserve is a financially prudent manner to take that I know other municipalities have taken as well when they take a look at the benefit usage, because there, as you know, in prior years you could have significant spikes in contributions, and there's years where you might not be utilizing the benefits as much as you thought you would have. So, the contribution that we intend to make this year is a significant contribution, and we think it would probably it does a lot as far as smoothing out tax rate implications into the future.
Hey, just to follow up, I agree that it is prudent to put it into a reserve account. My question is, why did it not all go into the reserve account? In other words, if it was destined for that use, why would we now deviate and not put 100% of the savings into that reserve?
Again, there are a couple approaches we could take. Is that we were utilizing a portion of that to balance the overall budget, because if you utilize the savings just put into the reserve, you no longer have that as a savings towards your overall operating budget for this year, as we need to do some cost containment. It was basically a revenue opportunity for us. County council always has the option to even be more financially prudent into potential future gains by putting the whole amount in. But either approach is fine.
Well, one has a direct impact on the future levy versus the one of putting it into the reserves, which has no impact on the levy.
Mr. Tifo, do you have something to add that might
Correct.
help clarify this?
Correct. In terms of the financial analysis, and in this case, the financial analysis of the usability of the benefits program, what we looked at was what we have there currently in terms of funds and surpluses. We withdrew a portion of it, as you saw, the $200,000 figure, and essentially 50% of that in a reserve. And when we came to that decision, we looked at our historical utilization and costs of the benefits program, where we are currently in terms of cash flow in that account, and therefore it is in a surplus. It is in a surplus in excess of the $200,000 that you've seen there. And when we thought about how much do we put in reserve, i.e. how much do we put back into, let's call it general funds, 50%, 100,000, we did consider to say, hey, look, in the next 3 months, 6 months, 9 months, 12 months, based on our historical numbers in non-COVID days and what we can anticipate in terms of catch up on benefit utilization, would we be safe? I.e., would we have to go out and draw back that $100,000 that we put in the general funds versus the reserves? And we are quite confident, given the account balances that we have currently, and then just the $100,000 in reserve, that we won't need to go and draw back that $100,000 that we put into the general levy dollars. So we've done the utilization assessment on that to comfortably say, hey, look, we can relinquish the $100,000 into the general levy without necessarily us saying, hey, we'll need to go back to the marketplace, go back to the ratepayer for that $100,000. So that was based on utilization and forecasting utilization, both internally and with our benefits consultants.
Okay, thank you.
Hey, is there any other questions about this report? Seeing none, all those in favor of receiving and filing that? That is carried. Thank you. We will move on to social services. We have 3 information reports here from social services, so maybe we'll deal with them individually. We need a mover and a seconder to have the first report on homeless system response to COVID-19 report on the floor. Moved by Warden Weber, seconded by Councillor Hand. Any questions or comments about that report? Councillor Hand.
Not sure if it's related, but a question regarding the people, the clients that have been put up in the hotels. I believe that was to come to an end, maybe August 21st, something like that. Is that still the plan?
Through you, Warden Weaver. At this time, we don't have an end date.
Oh, okay.
Ideally, we'll place all of the individuals into either supportive housing or permanent housing and then be able to close.
Okay, sorry. I don't know where I got that date in my head, but just curious. Thank you.
Okay. Any other questions about that report? And all those in favor of receiving and filing? That is carried, and we'll move on to B, which is the Housing and Homeless Plan Progress Report. Housing and Homeless Progress Report for 2019, which is attached. We need a mover and a seconder to have that report put on the floor. Moved by Councillor Cook, seconded by Councillor Broad. And was there anything, Ms. Calisante, that you wanted to highlight from that?
Certainly, thank you. So it's our legislative requirement just to do a progress report every year on our 10-year plan. And I'm pleased to announce that, in 2019, we did make some strides towards ending homelessness. With all of our community partners, we were able to place a number of people into permanent housing. We were able to provide some support programs for individuals through our partners, including LEO and CMHA, in providing the supports they need to remain housed. So we'll continue on with that work. And this year in our report, we did some individual stories that I would encourage you to take a moment and read. They really talk about individuals that live within Lambton County who are now successfully housed because of all the community partners we work with. So just some good news stories there for you to take a look at. Thank you.
Thank you so much for that. It is interesting to see those individual stories. It puts a name and a face to the issues that we're dealing with. So I really appreciated that. Is there any questions for Ms. Calisante? Then we will have a motion to receive and file that. All in favor? That is carried. And C, which is the Housing Services Statistical Report, we need a mover and a seconder for that report. Councillor Stark and Councillor Cook. Any questions or comments on that? Seeing none, all those in favor? That is carried. Thank you. And we do need to move in camera, so we do need a motion to move in camera. Moved by Councillor Broad, seconded by Councillor Loosely. Just to all of our fans who are out there watching, we will be moving back into open session to close the meeting, but we will not be going back online to do that. So we will wait until we are told that we are offline and we'll proceed in camera.